How does local anesthesia work for a skin biopsy? Have you ever wondered how doctors can perform skin biopsies with minimal discomfort? Local anesthesia plays a vital role in making these procedures more comfortable for patients. Local anesthesia works by temporarily blocking the nerves that carry pain signals from the skin to the brain. This means that the area where the biopsy is performed becomes numb, allowing the procedure to take place without pain. The most commonly used local anesthetic for skin biopsies is called lidocaine, also known as lignocaine. This medication is injected into the skin around the biopsy site to achieve numbness. When lidocaine is injected, it blocks sodium channels in nerve cells. This action prevents the initiation and conduction of nerve impulses that signal pain. Before the biopsy, the doctor will cleanse the area to ensure it is free from bacteria. They will then use a very fine needle to inject the local anesthetic. This technique helps minimize any discomfort during the injection. Sometimes, the anesthetic is combined with epinephrine, which is a substance that constricts blood vessels. This combination helps reduce bleeding during the biopsy and prolongs the numbing effect of the anesthetic. In some cases, sodium bicarbonate is added to the solution to lessen the burning sensation that can occur when the anesthetic is injected. There are various techniques for administering local anesthesia, depending on the type of biopsy and its location. One common method is infiltration, where the anesthetic is injected directly around the biopsy site. Other techniques include ring or field blocks, which involve injecting around a larger area, or peripheral nerve blocks that target specific nerve branches. For superficial biopsies or sensitive areas, topical anesthetics like Emla cream, which contains a mixture of lidocaine and prilocaine, can also be used. However, these topical options may not be as effective for deeper or thicker skin regions. After the injection, it usually takes a few minutes for the anesthetic to take full effect. During this time, the patient may feel a brief burning or pressure sensation. Once the area is numb, the biopsy can be performed with minimal or no pain. The depth of anesthesia is generally sufficient to cover the epidermis, dermis, and sometimes the subcutaneous tissue, depending on how deep the biopsy needs to be. In the context of skin cancer diagnosis and healthy skin management, effective local anesthesia is crucial. It allows for the precise and comfortable removal of suspicious skin lesions for pathological examination. This process is essential for accurate diagnosis and treatment planning for skin cancer and other dermatologic conditions. Additionally, local anesthesia helps minimize bleeding and improves procedural safety, making it easier for patients to cooperate during the biopsy. In summary, local anesthesia for skin biopsy works by chemically blocking nerve signals in the targeted skin area. This allows the biopsy to be performed painlessly and safely, supporting accurate diagnosis and treatment planning for skin cancer and other dermatologic issues. Always consult with a healthcare professional for personalized medical advice regarding any procedures.